Good afternoon. Thank you for being here. It is May 12th. Welcome to the daily info briefing at the Peoria City County Health Department. My name is Andrew Rand. I'm chairman of the Peoria County Board. I'm today's MC. On behalf of Honorable Mayor Jim Artis of the City of Peoria, Chairman Zimmerman from Tazewell, Chairman Krug from Woodford County, welcome and thank you for being here. Much ado this week and over the weekend about the national stories of compression rates in some markets regarding contagion and expansion rates in other communities regarding contagion. I think what we're talking about here locally in so many ways is a reflection of our resource capacity. Monica has some data for today, and I know the state released some interesting numbers earlier as well. Much of what remains important is that the shelter-in-place expectation exists. The methods by which all of us wash our hands, stay socially distant, wear the required masks, and wear them and fit them properly, which I think is something everybody could use some practice in based on some observations I've made, or maybe some training. Maybe Monica will do that. The idea that we're still working to limit the spread while we're slowly trying to crawl our way back to normalcy is still a perplexing issue. To that end, I will let Monica and invite her to describe where we are with some of those efforts, and join me in welcoming Director Hendrickson of the City County Health Department, our epidemiologist.
Thank you, Andrew. I begin today's briefing with our to-date values for the Tri-County region. To date, for Peoria, Tazewell, and Woodford County, we have 217 confirmed cases. That includes 145 in Peoria, 57 for Tazewell, and 15 for Woodford. Again, that's 145 for Peoria, 57 for Tazewell, and 15 for Woodford. There are no new deaths to report for the Tri-County region. In regard to the status of our cases as a Tri-County, 69% of our Tri-County cases are considered recovered, 22% of those cases are at home and isolating, and 5% of our cases are currently hospitalized. In regards to our hospital data, ICU bed use for the 4 hospitals, that's OSF St. Francis Medical Center, Unity Point Health Methodist, Proctor, and Pekin, 15 ICU beds are in use. 6 to persons under investigation, and 9 for confirmed COVID cases. In terms of our non-ICU beds in use, that is 37, and the hospitals do not report any deaths in the past 24 hours related to COVID. As we continue to monitor Heartland Health Services, I just want to remind everyone that tomorrow, Heartland Health Services will be expanding over to their 4th site, which will be in Pekin, out of Tazwood Wellness Center. But for today, Heartland Health Services reported that at East Bluff, they saw 201 individuals. At Carver, 87, so their total for today was 288 tests completed for Heartland Health Services. And again, tomorrow that site does open in Pekin. I do know that there's been a lot of dialogue in regards to the plan for our region. I believe the public information officers share this information, but there will be, rather than our routine 3:30 briefing tomorrow, we will be having a special meeting at 11 to answer questions specifically and go into more details regarding that plan. So in terms of questions for today, I'm more than happy to take any, but if it's regarding the plan that was submitted as a region, we'd like to have those for tomorrow.
So the East Bluff site used 201 today, so how many tests total are available at East Bluff now? Because it was originally 150, but with that movement of tests from the reduction of availability of Carver, I mean, how many tests are available now?
So right now, Heartland Health Services, in regards to the number of tests available, really focuses on 150 per site is what they want to average, recognizing that some sites will do more and less. And so again, per day right now with 2 sites open, they're looking at averaging 300 tests in a day. But as Sharon Adams, the CEO of Heartland Health Services, commented before, they do have the capacity to request more tests from the state. And so they have been monitoring the values. Just this weekend, the health department had a really huge uptake in tests as well. And we're seeing that in the East Bluff. And so that might be something that Heartland pursues further on, but they'll be the best to speak to that.
Could you go into what detail you know about the McLean County testing site moving here to the Peoria Civic Center?
I believe there's been some conversations about the McLean testing site, which is a federal testing site, closing. I'm not privy to all the details or what kind of those recommendations are. I believe that the governor's office was going to make some comments about what that site would look like in the next few days.
So as the Peoria County City Health Department, you have no idea about another testing site coming to downtown Peoria?
I think like many individuals, we've heard capacity about whether or not it's going to be somewhere in our Tri-County region, whether it's in Peoria or in Tazewell. But again, I believe that that still final decision rests with the governor's office.
Do you think that would be helpful to have another testing site here in the county area, Tri-County area?
So the question being if it'd be helpful to have a testing site here in the Tri-County region. I think overall testing sites in general, having more community-based testing is important. In the Restore Illinois plan, the governor really does address the fact that as we move to phases, one of the best things that we're going to be focusing on is testing capacity and those community-based testing sites. So I think any additional testing, whether it's here or in any other community, is going to always be welcomed.
So then from your perspective, as you have said, testing is going to be key to this. Just from your opinion, in our area, McLean County, the second highest in terms of local testing numbers, to take that site away, just kind of, what you think the potential impact would be of then the number of people having to come here.
So the question is, with the McLean site closing, what kind of issues that they might be having to face now? And I think that's really, really stronger to be addressed with their public health. I think they have a better understanding of what their situation is in that county. But I think overall, when you're talking about testing in general and what those impacts are, I think every local health department will say that we want more testing available. And so whether or not that's moving it to a different community or a community that hasn't had it, I can't speak to that. I do know, though, the McLean site is run by federal assets, and they do monitor how many tests have gone through, and they've seen decreases over time. And so that might be part of the decision making. But again, I think overall from a community standpoint, we just want to see more testing.
So I guess my question would be, what's the demand here? Because if the Heartland sites already have a lot of testing, enough to open 4 test sites in the Tri-County area, the Bloomington test site gets their test federally, which means that there's more criteria that they implement on who gets a test. It's not as wide as Peoria, where any adult can get a test regardless of whether they show symptoms. There's more restrictions. So I guess my question is, if I could go right now with no symptoms and get a test at one of the 4 Heartland sites, depending on which ones are open, what is my reason for wanting to go to the federal site also here in Peoria that I might not qualify for?
So the question being, what is the maybe incentive, or what would make the difference for someone to utilize the federal site? That I can't really speak to. Likewise, we submit data to the Illinois Department of Public Health as well as the Illinois Emergency Management Agency on our testing sites, and so they know what the capacity that Heartland has been supporting for the past few weeks, and so really that's a decision between the state entities and the federal government.
So Peoria County's not been involved in conversations at all about moving that site here? It's strictly at state and federal level?
It really is, because it is a federal asset. The decisions really sits with the state and federal levels. I know from our perspective as local health department, we approach it that is an equity approach. And so for us, we know we have in our Tri-County region, just really in a kind of smaller area, we do have 4 sites now up and operational this week. And so from an equity standpoint, we recognize the fact that we do have the capacity here. And so if they choose not to place another site here, I think that's a fine decision. If they choose to sit it here, again, that's going to be a decision that is really based on those federal needs that they have to meet. And it might be some criteria that they have that we are not aware of locally.
Is this going to be one of those things where the health department might want to say, if you feel sick, if you're showing signs, go here, and if you're not feeling sick and you're showing signs, go here, so that way you could get more folks, and instead of having everybody go into one site, and one site might not get used.
So I think the question is, depending on the federal priorities that are placed on any additional sites that are run by those assets, triaging people to different sites. I mean, I think the health department is going to make sure that those testing sites and information is available on all of our media posts as well as our community, so people can understand the different nuances those sites might have. But I think overall a message is going to always be, for an individual, if you feel that you have symptoms or been exposed, or one of those essential workers, definitely go get tested. And because of the ability to go with asymptomatic individuals to get tested, there should be no reason why you can't be tested again if you're 18 and older.
I happen to have asked the same thing yesterday, but maybe you have more data, maybe you've thought about it more. Are you seeing more folks coming back to get a second test, or is that a rare thing?
That's, I think, a question of whether or not people are coming back and doing repeat testing at Heartland Health Services. I think that question is really more directed to Heartland Health Services. They are working with the University of Illinois College of Medicine to kind of get a better understanding of their data points. I know their CEO was able to share the fact that so many percentage, 42% of the individuals that were tested positive were asymptomatic. And so I think that's more directed to Heartland and what they're doing in terms of monitoring their data points.
Monica, I know I've asked you about this before, but I've gotten a number of people emailing me asking about this. When do we think, in terms of a local level, the everyday person, not necessarily a politician, et cetera, that the everyday person would have access to those almost immediate tests that we talk about?
So in terms of the different tests and when the availability will happen, I think that's really, that's a really good question, because when we get more testing or more surveillance tools, which testing is, the better equipped we are to actually understand and respond to this pandemic. And so the FDA process, and I think we should recognize the fact that the FDA process is stringent for a reason. We don't want to make sure that we are getting subpar tests or other things, because true healthcare decisions are based off of them. I think from a local level, I do know that some of our providers are part of research studies to validate the data, and so as soon as we can get more through that process, I'm hoping we see something in the fall or in the winter for those tests, around the same time that we're going to be testing people for influenza.
I have a question for you.
Okay. Are there any other additional questions?
Dr. Ngaze Ezike today with the Illinois Department of Public Health said that they're going to start subtracting deaths that were not directly related to COVID-19 from the state total. Can you confirm if locally I know we don't have that many deaths, but were they all COVID related?
So the question is, with the new guidance from IDPH, whether or not those deaths where COVID was tested within a certain time frame of a death, will we be taking them out of our count for that? We are actually hoping to get some further guidance from the state on our totals to recognize that. And it's really hard. I can speak for the deaths that we had. All of them had comorbidities. COVID was definitely definitely sped up or had an impact on an individual's health. In other cases, it was definitely maybe a tertiary or further underlying issue, and I think that's a conversation that we'll be pursuing with our coroner's office.
Just to actually piggyback off of what she said, and I know you said you need more guidance, but can you tell us what is considered a COVID-19 death? If somebody gets into a car accident, but they had COVID-19, is it a COVID-19 death?
So right now, the way the state has done COVID deaths is that if you have, and there is, again, medical and coroner discretion in this, but depending on when you were tested for COVID and you had a confirmed positive test and it impacted your health in that time frame, it's part of your death certificate, so to speak. And so the reason why Illinois Department of Public Health, and we are seeing this, and I applaud Illinois Department of Public Health for doing this, is that they are taking a much more aggressive stand on everything from long-term care facilities to even reporting deaths, because we recognize it is going to be harder to go the other direction. So they're going to be more overly sensitive to those values. And so right now, for example, if I were to get admitted to the hospital and had for a procedure, was tested positive for COVID, something happened during the procedure, the coroner and the medical would review, but if my test result came back positive, it would show up right now in our reporting as an underlying condition. Now, whether it's actually attributed to death is a different story, and that's where I think Illinois Department of Public Health is now wanting to make sure they can go back and start reviewing some of that criteria. If we're not familiar, there was a case out in California where a teenager was previously attributed, and then they kind of went back, I think, on that case too. So, want to making sure that we are standardizing out reporting. So,
I just have a question for Mr. Ryan.
okay. Andrew, I think you're up next.
Yes.
So Governor Hendrickson said $25 million will go to local communities to jumpstart construction projects, but those communities have to apply for that money. I wanted to know if you or other local leaders you know are going to be applying, and if so, how would that money be used?
Is that an announcement from today? They're changing the roadmap of the CARES formula distribution almost weekly. So there have been a couple of pronouncements made just this week, one of them including favorably impacting hospitals. So I'm unfamiliar with that particular distribution. I will say that together with state and county and municipal governments across Illinois, we are working hard to be included in the next CARES Act for replacement funding that we have lost across the board that is impacting our operating budgets as we speak today. The county plans on amending theirs this week, and I think the city will tonight as well. That $25 million is just a new blip on the radar, so I'll have to look at what the specifics are.
So upon becoming familiar to it, do you think it's something that you would do because it's for construction projects?
Of course. I mean, if it's available in Peoria County and we qualify, we certainly want to be first in line.
Mr. Rand, the state has gotten money under the first CARES Act to help out local towns, but the assembly has not met due to COVID, to the crisis. Are you aware of any plans that are being made or any acts that are being done to try to start to pass that money out? Because right now it's just sitting in the bank someplace.
I'm glad you remember that those funds are available. I think they come with some pretty big strings on them as to what they're eligible for. I won't speak for area legislators, but I know I speak to area legislators almost daily. Bringing together a session in Springfield of both chambers is a very complex subject. Not only are those dollars out there as something that could be distributed with purpose according to the guidelines, but the state of Illinois is going to need a budget soon too. And if you study the current calendar, that clock has been ticking for some time. If you'll ask that same question of people elected to both the Illinois Senate or House, there'll be a couple or three versions of how urgent it is to figure out how to get them back in session.
That first CARES Act money was not for lost revenue, it was for cost.
Correct.
Due to the COVID.
Emergency expenditures unanticipated by governments, much like our health department. All the local governments, the county, the city, the health department authorities here in Peoria County are keeping a list of expenses that were unanticipated. We all probably have a special general ledger code for them so that we can book them with a footnote that validates what that unique expenditure was. That is correct, what you just said.
Chairman Rand, Mayor Artis has cited saying that the testing site would be coming to the Peoria Civic Center, specifically the parking lot. Could you share what you know of the situation?
I think I know the same things he does. That's expected Friday, and the plans are to test first responders and those that are symptomatic, and I think they expect to open that Friday.
So it would be the similar guidelines as to what's currently going on in McLean County?
If those words I just used to you just are narrower than the guidelines Heartland Community Health Clinic is using. Heartland Health Clinic now is testing all 18 and up. Symptoms or not, first responders or not, had some icky pains or not. There aren't very many exclusions except, I think, for minors.
Do you know how many tests would be available at that site?
No, I think you can make some inference off of what they were prepared in their testing capacity each day in Bloomington per National Guard stand-up. Is the Illinois Guard? Where's the National Guard? I think it's the State Guard's doing it. But I don't know what the specifics would be here. The capacity seems to me to be the number 250 is what I hear.
So just to clarify, from what you understand, it wouldn't be the same Heartland guidelines where here everyone
Correct.
18 and up can get tested. It would be more specific to those symptomatic and those on the front lines.
Yes.
As someone who is the head of the of AMT, have any of your workers been tested positive?
We are testing often, frequently, and have really comprehensive monitoring programs in place, Mr. Kravitz. Our Peoria-based operations are all negative at this time. It's been quite a chore.
Just to go back to the site for the Civic Center, do you know what the timeline is on that? Is that open next week?
I think their plans are Friday.
This Friday? Okay.
So I see that, the county administrator got a retroactive 2.5% raise, March 12th. And I know that this Thursday, the Peoria County Board is meeting, to potentially make cuts to make sure that they can fill this gap in the budget. I wanted to know, how is that gonna work out? Will he still be getting more money as you all decide to cut public safety or whatever else that you need to do in order to fill the gap?
The Peoria County Administrator Scott Sorrell does an extraordinary job. We have performance-based criteria that he's provided with each year, real hard goal setting and objective setting. The entire executive committee, which consists of myself and 10 other members, reviews his adherence to those objectives, and he received a very favorable evaluation for this year. Contractually, we are obligated to pay the county administrator what our contract says we will do, and we will follow that contract.
Okay, so there's no way that he'll get a lower pay raise than, or that there's no way that you all would choose to lower his pay raise above cutting people that work in the county?
Much like our collective bargaining agreements, where those agreements specify what the relationship is between management and labor and what those obligations are under the agreement, unless we chose to ask bargaining units to reopen or wanted to go back and ask the administrator to reopen, or him and reversing that around, voluntarily doing it, we are obligated based on the contract to treat him as we agreed to.
But in the past, sir, I can remember when Pat Urick was the head of the county, he turned it down. Has there been, while you may have to do it based upon the deal that you have with him, has there been any discussion whether Scott would voluntarily give that up? Because he can't do that.
So, your first observation was Mr. Urick gave up some funds.
Years.
It's been a while since Mr. Urick left our employ. I mean, I was elected when he was our administrator. I don't recall that. I do recall that being true with his current employer, the city of Peoria. With respect to Mr. Sorrell, again, he's done an extraordinary job. during extraordinary times, and just in the last 30 months has returned $5 million to the general fund. We have gone from a government of 1,028 people down to 700. He has spent the last 3 years of his life working through the Hendrickson Oak Challenge, trying to do our level best to right-size that entity. And now, of course, as you know, we're facing exiting the business, which will lean our county to 600 employees. The elected officials are accountable for 60% of all the present spending in Peoria County. The county administrator is only got the remaining 40%, and after Hendrickson will be down to 20. Compared to his peers, he is right in the middle, or just a little bit of the mean value paid to them, and certainly his additional benefits, the other fringes that are on his contract, are extremely modest. So as chairman, I would say to you, I'm going to support his compensation. It's required by contract, and we'll see where that goes on Thursday night.
Is Mr. Thoreau here for questions?
He is, but I would suggest he not take questions about his contract. That's just a matter, a confidential employment matter between the government and him.
Thank you, Chairman Rand.
Thank you, Monica.
With that, again, just a reminder, instead of our usual briefing tomorrow, we will be moving up for a special briefing to address the plan that was, I think, part of that discussion. So, again, we'll be seeing you guys at 11, and it will be virtual.
So
Thank you.
there is no 3:30.
There'll be no 3:30 tomorrow.